Hello everyone, I am Dr. Murtaza Kamal. I am a structural fetal and pediatric interventional cardiologist. I work at Aster Ramesh Hospital, Vijayawada, and today we will be discussing about the conditions in which fetal echocardiography is needed. We all are aware that fetal echocardiography basically is a uh, tool in which we are able to see the heart of the babies which are unborn. They are still inside the womb of the mother, and we are able to scan the heart in those conditions. By this, we are able to see the structure of the heart, whether it is functioning properly or not, is there any amount of fluid around the heart or not, or if the heart rate, rhythm, if they are normal or not. So all these will be collectively seen in fetal echocardiography. So fetal echocardiography basically is needed in different conditions. The conditions can arise due to maternal issues. The conditions can arise due to fetal issues, or it can be other related genetic issues or other related things. So today we will be seeing all what are the different conditions in which it is needed. Moving on to the maternal conditions in which this fetal echo is needed. First is congenital heart disease. If the mother had some congenital heart disease, whether corrected or uncorrected, there is chances of the baby to have congenital heart disease. It is as high as up to 3%. That is, out of 100 babies which are born to mothers with a congenital heart disease, 3 of them can have a congenital heart disease. If the mother has been exposed to some teratogene during the first trimester of pregnancy, basically during the first 12 weeks of pregnancy, teratogens like lithium, any retinoids, cocaine, or anti-epileptics which the mother is taking, these can also lead to congenital heart disease in the children. Certain mother diseases like metabolic disorders, including phenylketonuria, or the mother has diabetes before or during the pregnancy, this can also lead to the increase in the incidence of congenital heart disease. Certain autoimmune diseases like SLE, anti-SSA, anti-SSB, or Sjogren syndrome in the mother increases the possibility of the child to have congenital heart disease. Infections during the pregnancy, like torch infections, CMV, toxoplasmosis, Lyme diseases, also increases the rate. As the age of the mother advances more than 40 years, then the chances of CHD in the child increases. A mother who has a BMI of more than 40 kilogram per meter square, those who are overweight, obese, the chances of CHD having babies having CHDs in those mothers increases. And those couple who have conceived with in vitro fertilization, the chances of having congenital heart disease also increases in those conditions. So, in all of these conditions, a fetal echo should be done, which is normally done around 18 weeks to 24 weeks, and it is always done after the anomaly scan, which is the TIFA scan. Moving on to the other spectrum, there are certain fetal problems which have been found and that can lead to congenital heart diseases in the fetus and show a fetal echo is warranted. Like if there was an abnormal TIFA scan, the ultrasound scanning which was done around 18 weeks for anomalies, it came out to be normal. The cardiac screening was abnormal. There was increased nuchal translucency. There was some abnormal heart rate or the rhythm disturbances were there, or their heart rate was very high or very low, or any abnormal views which were seen in a TIFA scan, then it warrants a fetal echocardiography. Certain fetal chromosomal anomalies can lead to syndromes, and so fetal echocardiography should be done in these cases. If there are features of hydrops, by hydrops I mean that there is fluid in two cavities, so in those cases, heart should be seen scanned. Those conditions in which there is twin pregnancy and mostly monochorionic twins, they can have conditions known as twin reversed arterial perfusion or twin to twin transfusion syndromes. Basically, in monochorionic twins, fetal echocardiography should be seen. In TIFA scanning, if some extra cardiac anomalies have been found, like those organs have been found abnormal, like if there is some lung problem or congenital diaphragmatic hernia, any problems in the stomach, diaphragm, omphalocele, or any atresia in the intestinal tract, any problem in the neurological system like spina bifida or vertebral anomalies or limb anomalies have been found, so heart should always be scanned in those cases because they are a part of the spectrum which can be either vectoral anomaly or some syndromes. So heart should always be scanned in those cases. And if there is some abnormality of the placenta or the umbilical cord, fetal scanning should be done in those cases. There are some certain other indications in which fetal scanning should be done, which includes a first degree relative who had a congenital heart disease. Then the chances of having congenital heart disease in this baby increases. Like if the father or the siblings of the child had some CHD in the past, so this child also has the chances of increasing CHD, so they should be screened. Certain Mendelian genetic syndromes, in which include CHD as a part of them, are Noonan syndrome or tuberous sclerosis or Dijot syndrome. So invariably, heart can be involved in those cases, so they warrant a fetal echocardiography. Chromosomal syndromes which are associated with CHD, like trisomy 21, trisomy 13, or Edwards syndrome, or Turner syndrome X0, these are some other indications of getting a fetal echocardiography. So basically, these were the indications which were needed for fetal echocardiography. So, like nowadays, as we are increasing day by day, the chances of like we are getting every patient is getting TIFA scan or anomaly scan done, and even fetal echocardiography is now becoming a routine in these cases. So, fetal echocardiography should invariably be used, and it is a useful tool for screening of congenital anomalies. And if any anomaly has been found in those cases, it can be like the baby can be transferred in utero to a center which has a cardiac tertiary level pediatric cardiac facilities, and they can be taken care of properly, which because many conditions in congenital heart disease are like such, which need variant treatment or intervention within first 7 days of life. So the diagnosis after neonatal age, transportation, the cost, incurs, the tension, the anxiety of the parents, all are reduced to a certain extent if we know that there is some problem in the heart, and it can be taken care of immediately after the procedure. So thank you, thanks a lot. We'll be coming up with next recording.